Hey guys, John Adamson, the Rehab and Documentation Guru. Today, an interesting case for you. My very first one. When I saw this patient pop up as an admit and a request for a therapist, I hopped on it because I was very curious about this. Patient with a confirmed by the doctor COVID vaccination injury. So, how did this injury look on this particular patient? Well, she is elderly. She has some comorbidities. I'll just tell you she's in her 80s and she has some heart history and arthritis. After getting the vaccination, that day when she got home, she experienced greatly increased appetite, like unusual increase in appetite. And the next day, this increased appetite continued, but then it started to change. And she became progressively weaker as the second day after vaccination went along. That either that night or early the next day, while transferring, she had a fall and was so weak they had to call EMS to come help her, and she could not walk at that point. She had been walking about 75 feet max prior to this, but she was unable to walk, requiring extensive assistance for all mobility and all ADLs, whereas previously she'd had very limited assistance needed. So, anyway, confirmed vaccine injury. That's, first of all, kudos to the doctor for having the guts to use that as a diagnosis. And yes, there are vaccine injury diagnoses. And I say guts because this has really become a political football that you cannot say anything ill about these vaccines. By the way, this was a Moderna first phase, and now the family is not sure they're going to go through with phase 2 because it is known, it has been widely reported that the phase 2 vaccine tends to be even more impactful. By the way, in case you're wondering, in case you're interested, the CDC just came out with a study showing that the first shot may be almost as effective as getting both. They do still recommend getting both, but in one study they showed something like 80% coverage by the first shot, and then of course about 90 by the second, which is pretty darn good, you know. So anyway, they're weighing this now. But how did this lady present? Well, very weak. But what was concerning about her was she was having problems with an erratic heart rate. Now, I didn't see her before, but she does have a history of AFib, and she's on medicine for AFib. And also her blood pressure was pretty darn low, although she was asymptomatic. And they did have her on pretty extensive blood pressure meds because of her CHF history. But the daughter describes that she was excessively dry. She is peeing a little bit on the amber colored side. And she does report thirst. And so, anyway, I suggested to her that they might want to talk to the doctor as soon as possible about fluid intake because I suspect she's a little bit dehydrated. And of course, the cardiac arrhythmia may be exacerbated by what's going on with the blood pressure. So, anyway, there you have it, folks. And something about vaccination injuries you might want to keep in mind is that there is a national registry that ends up tracking these, and it is estimated that vaccination injuries are underreported to the tune of only about 10% actual reporting of vaccination injury. Think about that. That's pretty significant. And when you have a political football like COVID vaccine, you can imagine that there's a reluctance because these vaccination injuries can be generated by medical professionals. And that's why I said kudos to this doctor, because I'm sure there was a lot of pressure on some of these doctors to not give a diagnosis of COVID vaccination injury. I guarantee there's a lot. And I would just encourage you, because think about this. This has potential ramifications to your patient's quality of life when they get the vaccine. If they have like some kind of immediate or even slightly delayed response, what that appears to be related to the vaccination, you may say to them, have you reported your symptoms after your vaccine? Because if something were to happen to them, like a catastrophic event, there have been some catastrophic events some individuals have suffered after getting these vaccines, they need legal recourse. And getting the diagnosis of vaccination injury from a doctor could end up helping them and protecting them. So anyway, that's just an aside. But anyway, I'd be curious to hear. Of course, if you leave a comment about this, you'll notice I'm misspelling on purpose these videos because YouTube will take them down. They will screen them. They will take them down. Even though what I just shared with you about a specific patient given a specific diagnosis by a practitioner of medicine, they will still take it down as misinformation, which lets you know it's a political football. Anyway, hope you're having a great day, great evening. Take care. God bless.